Can red light therapy help treat your eczema? Living with eczema can feel like a never-ending battle. Itchy skin, red patches, sleepless nights, and a drawer full of creams that don't always help. But what if there was a gentler, non-invasive tool that could support your skin's healing? We will look at the science behind red light therapy, what it is, how it works, and whether it could actually help treat eczema. We'll also talk about differences between men and women in eczema causes, and whether those trendy red light masks are worth your money. But first, what is eczema and why it's a problem? Eczema, also known as atopic dermatitis, is a chronic inflammatory skin condition that causes redness, dryness, intense itching, and even pain. According to the National Eczema Association, over 31 million Americans are affected by it, and that includes babies, kids, and adults. The skin of someone with eczema has a weakened barrier, meaning it loses moisture more easily and allows irritants in. Triggers of eczema can range from allergens and harsh soaps, through to stress and climate changes. And unlike occasional dry skin, eczema is a persistent and often deeply frustrating condition. Here's what eczema sufferers deal with daily. Constant itching that leads to scratching, which can cause skin tears or infections. Burning, inflammation, and painful flare-ups. Trouble sleeping due to discomfort. And the emotional toll, anxiety, self-consciousness, and frustration. Prescribed steroids and their long-term use can also come with side effects, like skin thinning or hormonal imbalances. So finding gentle, alternative solutions to eczema is a growing priority, including the research into the use of red light therapy treatments. But, can it help, and how does red light therapy work? Red light therapy, also called photobiomodulation or low-level laser therapy, is a treatment that uses specific wavelengths of light, typically between 600 and 850 nanometers, to penetrate the skin and activate healing processes at the cellular level. Here's how it works. When red or near-infrared light hits your skin, it reaches the mitochondria in your cells, the energy powerhouse. This boosts the production of ATP, or cellular energy, which helps your skin cells repair themselves faster and function more efficiently. It also reduces the release of inflammatory molecules like TNF-alpha and IL-6, promotes collagen production and speeds up tissue regeneration, improves blood circulation, helping deliver nutrients and remove waste. According to Dr. Michael Hamblin, a Harvard researcher and pioneer in the field, red light therapy shows significant anti-inflammatory effects without damaging tissue. And that's why it's being explored for a range of skin issues, from wrinkles to acne, and now, eczema. But can these benefits help? Let's connect the dots. Can red light therapy actually work to help manage the condition and the symptoms? The answer? Well, the research is promising. Red light therapy helps in several key areas that matter to people with eczema. 1. Anti-inflammation. Reduces the chronic inflammation driving flare-ups. 2. Skin repair. Stimulates skin cell regeneration and boosts collagen, aiding in healing cracked, broken skin. 3. Reduced itch and pain. Calms the nerve endings in inflamed skin, relieving discomfort. 4. Lower reliance on steroids. By supporting natural skin repair, it may reduce the need for topical medications. A 2021 clinical study in the journal Photodermatology, Photoimmunology and Photomedicine found that patients with moderate eczema who received red light therapy 3 times a week showed significant improvements in itching, redness, and inflammation. Now, let's be clear. Red light therapy is not a cure for eczema. But it can be a powerful adjunct therapy, something to use alongside your dermatologist-recommended treatments to get better results, naturally. Eczema differences between men and women. Did you know eczema behaves differently in men and women? While men are slightly more likely to get eczema in childhood, women are more prone to developing or continuing to have eczema into adulthood. One big reason? Hormones. Women often experience eczema flare-ups around menstrual cycles, pregnancy, menopause. Estrogen fluctuations can affect the skin barrier, and women are also more likely to have jobs involving frequent hand-washing or chemical exposure, like nursing or food prep, triggering conditions like hand eczema. Understanding these differences helps when customizing treatment strategies, including those that involve red light therapy. So, do home red light therapy masks help? And what about those red light masks you've seen all over social media? Can they really help with eczema? The answer is maybe yes, if you use the right kind of device. For red light therapy to be effective, the device should emit wavelengths between 630 and 850 nanometers. Be FDA cleared or clinically tested for safety. Have enough power output to actually penetrate the skin, not just glow. Home use masks can be a good option for facial eczema, while handheld panels or wands might be better for body areas like arms, legs, or the back. According to a review in Seminars in Cutaneous Medicine and Surgery, light-emitting diode (LED) therapy is safe for regular use, but results depend heavily on the quality and consistency of use. So, can red light therapy treat eczema? Not exactly, but it can definitely help manage it. By reducing inflammation, speeding up healing, and calming irritated skin, red light therapy is emerging as a safe, non-invasive support tool for eczema sufferers. As always, talk to your dermatologist before starting any new treatment, especially if you have severe or infected eczema. If you found this video helpful, give it a thumbs up and subscribe for more science-backed skincare tips. Have you tried red light therapy? Let us know your experience in the comments, and to find your own light therapy mask for home use, check the links below. Thanks for watching.